Welcome back to The Blend. You know, caring for an aging parent or loved one is a challenge none of us want to face, but we have to be ready for it. So the question is, how can you truly be prepared?
Yes, here with some helpful tips is Dr. Judd Fisher. He's Affiliate Medical Director with Healthcare Partners Medical Group. Good morning.
Good morning.
Hello, sir.
Nice
Doctor,
to see you.
Great to have you here. You're here to tell us today a little bit about what we can do to prepare for taking care of an aging parent. This is a very important time of life. What advice do you have?
A few things. It's important to learn as much as you can about your loved one's disability or illness and to try to determine what you can do to help them. It's, as a caregiver, the more you understand about your role as a caregiver, the less anxious you'll feel and the more effective you'll be for your loved one.
Absolutely. What else can you do to help your parents and loved ones, help keep them mentally activated and ready?
Well, you know, it's really important to be there to support and love your parents, loved ones who you're acting as caregiver for, but you don't need to do everything. It's crucial to try to help them maintain their independence. So please ask them to continue to do tasks or activities that you feel they can still safely do.
Yeah.
Very important.
Well, and we've touched on that topic before on this show, and that is allowing people to feel self-sufficient and also feel like they still are engaged in the community and have a purpose. Isn't that what you're saying?
Very much so.
Yeah.
We don't want to go in as a caregiver and completely take over and take everything away from our parents. We want them to have as much independence as possible. It gives them motivation and a purpose.
Now, why is right now the best time to have this conversation?
Well, now through December 7th is Medicare open enrollment. And for Medicare beneficiaries, it means that it's the one time of year that they have to review their Medicare options and their plan so that they can actually...
Oh, we got a little microphone here.
There we go. Boom.
There
I was
we
trying to
go.
do a covert.
You did a good job, Sean.
so that they can actually change their Medicare benefits. If they do not take this opportunity before December 7th to change their plan, they'll have to wait another entire year to make those changes.
Absolutely, so now's the time.
I'd like to just point out, you were a great caregiver just
There
then.
we go. I was
Very good. Excellent.
You
His
reached
microphone
over.
was somewhere else where you can't hear much, frankly, so we wanted to make sure it was close to you.
Thank you.
When it comes to Medicare plans, what should you keep in mind? Because I think Medicare open enrollment can be a daunting task for some people. There's so many different options and questions that come up this time of year.
Very much so. And some of the first questions I think that as caregivers we should ask is, does the plan cover prescriptions that our loved one needs? Does the plan have other options for vision or dental care?
Dental's important too because it's often kind of cast
not
aside.
there.
Yeah.
Yes. And really most importantly, one of the things that I really strongly push is, does the plan have a patient care model that really puts the patient first, such as Healthcare Partners' Total Care Model?
Yeah, let's talk about the total care model that you offer at Healthcare Partners.
Well, we have a total care model that addresses the patient from A to Z. From the moment you sign up with us, you are there. We have a support team that is contacting you almost immediately once you sign up with Healthcare Partners to try to answer your healthcare needs. We make sure you have a scheduled appointment with your primary care physician, and we put our arms around you and try to make sure that you feel as though you have someone to go to for your medical needs at all times.
And the best way I can put it is, because I know, you know, just as the schmo like myself going into the doctor's office, not having to fill out the same information about yourself into every specialist you walk into, they're going to know already because they're on the same network. If you're with a Healthcare Partners doctor or a specialist, they have all the same records. You don't have to wait for something to get up faxed for 3 hours. It's all there.
Exactly.
It's so easy.
Exactly.
Isn't it like the true definition of a network?
Yes, truly.
In medicine?
Yes.
Yeah.
Yes.
It's very nice.
Yep.
So I mean, how many locations are there for Healthcare Partners? That's a tough one to count now.
We have around 50 locations
Wow.
in
Wow.
Nye and Clark County.
That's fantastic.
Yes.
And where can we find you?
Well, I am a medical director now for the
Oh, now
affiliate program.
you're everywhere.
So
He's like, I'm an anomaly.
I'm working with the affiliate program, but certainly our goal is to try to get our patients and future patients so that they understand what we can do for them. And We are going to be having various events throughout the valley in the near future, and it'll give the patients an opportunity to meet one of our providers and discuss all the services that we offer.
And prepare them for this open enrollment.
Very much so.
Deadline's coming up soon. We got a little more than a month to go.
Yes, December 7th is the last day for Medicare open enrollment.
All right,
Excellent.
Dr.
And if
Fisher.
people would like to know more about Healthcare Partners, where should they go?
We're going to have something here on the screen for you that'll give
Excellent.
a website that they can either learn more about events that we're having and also
There it is.
find a location near you where they can go ahead and participate in one of our upcoming events.
Excellent. It's great having you. Thank
Thank
you
you
so
so
much.
much.
Thank you. Medicare open enrollment is happening now. It goes through December 7th. To find out more about your healthcare options, just head to openenrollmentnv.com or call the number on your screen.